The Philippines. You probably know this Southeast Asian nation for its beautiful beaches, for its tropical fruit. But the truth is, this heavenly little cluster of over 7,000 islands is best known for its people. Anyone who has ever dealt with a good-humoured Pinoy will soon discover the distinct virtue of malasakit. Malasakit is a deep sense of concern, for the sake of a task or for the sake of another. This very malasakit extends to a Filipino's work, resulting in not a few breakthroughs in the medical field. Inventive Filipino medical practitioners have been responsible for a lot of firsts. Dr. George Camara performed the first ever teleophthalmology operation. Dr. Baldomero Oliveira discovered biomolecules in Philippine marine snails now used in international neuroscience research. The fracture classification manual used all over the world was written by Dr. Ramon Gustillo. It's not just their brilliance that makes Filipino doctors popular, it's how well they treat their patients. To say that Dr. Sam Bernal's credentials are impressive is an understatement. He has taught at Harvard and Boston University, practices law, has an MBA, and is a cancer survivor. He is also recognized for pioneering a treatment that takes a patient's own healthy cells and lets it fight the cancerous ones, a procedure known all over the world as cellular therapy. Sandy Higgins, a regional advertising professional based in Hong Kong and Manila, is a beneficiary of Filipino treatment innovation.
Basically, I was diagnosed with breast cancer about 4 years ago. When I met Sam Bernal, I realized that this was a man who probably would go beyond the norm.
One important characteristic of bioregenerative medicine and stem cell therapy is that it's very labor intensive. We have enough of those people who are committed to the human side of science that I found it easier to be able to institute a customized, labor-intensive project in the Philippines than I have been able to do in other countries.
Philippine healthcare has also made its impression on other foreign visitors and residents.
My mother does. She really suffers from severe migraines, and these have been going on for about 10 years now. We waited just only 5 minutes in the waiting room, and then straight away Dr. Lopez was able to instantly, within like 30 seconds, pinpoint where the root of the pain was coming from. Something quite simple was diagnosed so quickly.
So I was having a growth, and if they didn't find the source, I'd then have another growth, and another, and another. Fortunately, at St. Luke's, they had a new PET scanner, which was capable of investigating and scanning me to find out exactly where the problem was. Now, the important thing from my point of view was that if I'd been in the UK or somewhere else, I couldn't have had this done. First of all, there's a 3-month wait for a PET scan. You can go straight in and go and have a PET scan straight away, because we have the equipment here and we have the people to use it.
Here, the radiologist, the anesthesiologist, the general surgeon, the specialist, the psychologist, all get together and collaborate in this interdisciplinary approach. You have this sense that you're in very good, capable hands. I made it very clear to anybody that if I get sick at any time, I need to be on the next flight to Manila.
Among Filipino doctors, a good number who have served in prestigious US hospitals have returned to cascade their knowledge to younger practitioners and head departments of local medical facilities. Indeed, the Philippines' fine hospitals have impressed the world with their remarkable outcomes. In fact, in a tracking of hospital quality indicators, according to the International Nosocomial Infection Control Consortium, or INICC, A healthy sampling of Philippine hospitals have shown remarkably low infection rates. And while the private sector has committed to continuous improvement through international accreditation, the Philippine government's cluster of specialty hospitals has proven themselves capable of responding to global market needs while delivering the best patient safety and low mortality outcomes. A perfect example is the Philippine Heart Center, whose outcomes can compare to the world's top hospitals, making it only a matter of time before the institution becomes the first facility in Asia to achieve international accreditation by Accreditation Canada.
We have 6 operating rooms that are dedicated to cardiac surgery. We do around 10 to 12 cardiac cases a day. And we do this for about 2,500 to 3,000 patients a year, all cardiovascular cases. We have, I think, the best equipment that are available for the care of a cardiac patient, and we have not stopped upgrading our facilities.
Over at the National Kidney Transplant Institute, there is excitement over a new acquisition that is a first in Asia, the Ablatherm. Relatively non-invasive, this equipment, used for treating prostate cancer at the early stages, is said to be able to deliver a 75 to 80% success rate. The quality and infrastructure of Philippine healthcare has truly evolved and continues to evolve with the government's full support. The pool of internationally trained and experienced physicians continues to deepen.
Basically, we have an army of people who are just eager and ready to be able to apply their talents to provide the best care in a customized way to each patient.
And while good value for money is a reason to choose the Philippine facilities, offering up to 80% cost savings over its Western counterparts, having no risk of miscommunication is their edge over their Asian neighbors. Everyone can speak English fluently. Another reflection of the Filipinos' unique brand of healthcare is that visitors and relatives in Philippine hospitals are allowed to see their loved ones 24/7. So patients never have to feel alone. The ready, warm smile, the hearty sense of humor, it all reveals a positive outlook on life. While the country's excellent physicians and world-class medical facilities are certainly good enough reasons to take your medical needs to the Philippines, the most compelling may very well be the loving companionship of the Filipino health workers.